Item 15, review and discussion of 2025 budget and 2024 proposed tax rate.
So we wanted to start off with a quick review of the budget. As it stands right now, again, it is still a living, breathing, it did not change a little bit between. And another thing we might need to look at, I know we put it off last time on how many budget meetings y'all want to have before we get into the public hearing. But we do have, Joe's been working diligently with Casey, and they do have a document to present with kind of an overview in the same manner. And I'll turn it over kind of to Joe, and we'll go from there.
Budget summary for fiscal year 2025. Total patient revenue budget is at $92,770,000, and this is combined for the hospital district, includes the hospital and the clinics. This is increased by 8% over the current year for anticipated volume growth, and this is based on the current fiscal year growth of 12% for the hospital and 9% in the clinics. Our net revenue is budgeted at $34,082,000, and that's at 36.74% of the total patient revenue. That's based on historical values and no expected major changes in the payer mix for next year. Total operating expenses, $38,792,000, and of that, the salary and wages are $15,594,000. And that cost was increased by $487,000. Benefits total budgeted $2,955,000, and that was increased by about $68,000. And that is to allow for an increased employer contribution cost for health insurance for next year. Supplies budgeted at $3,651,000. And they were increased based on expected volume growth and includes an inflationary factor also. All other operating expenses adjusted appropriately based on historical data and anticipated operational changes. Our budgeted operating loss, as determined by all the above there, gets a loss of $4,710,000 for next year. The current fiscal year operating loss is projected at about $5 million. Property taxes at net $4,735,000 for next year, and that is based on assessed values and a tax rate increase of 8% on the M&O, of course, just on the M&O portion. That gives us a net income for the year of $374,000, and then results in an estimated positive cash flow next year of about $723,000.
So you anticipate our losses to be less next year than they are this year?
Slightly less, and most of that you're going to get in the volume growth, the revenue growth. And that's what we anticipate. Because we're going to talk about the MRI and increased volume there, some potential more revenue in surgery.
Dr. Conrad coming on board, Dr. Bocanegra coming on board.
Refresh my memory, Conrad and Bocanegra are in what areas?
Dr. Conrad is coming out of Seattle.
No, I don't even specialty.
A surgeon, general.
Surgeon.
So Dr. Conrad does general surgery, he does wound care, he does some cosmetic, plastic surgeries, and then he also, we've got to work through that arrangement. We're not touching that until we get surgery established, but he also runs a med spa with all the laser therapies and the things like that, and he's bringing all that equipment with him, and we will partner with him probably at the con location first and putting in a med spa type thing. We got to work through the details of that, but our big focus right now is getting the surgery piece up and going. We are losing some surgery volume out of the ER, and I think Dr. Conrad's going to be one of the first things we'll have to look at not long after him getting here is having a surgery call crew available on weekends. So if an appendectomy or anything comes in the ER over the weekend, we got a crew available to come in and do it. Dr. Conrad has expressed he's more than happy to do it. If he's in town and available, he will be more than happy to come in and do this, I think. So I think we're going to see some growth there. The addition of Dr. Bocanegra, we will see some growth there. And then it's not out of the question that we might not be having another doctor or PA here during He's family practice.
Practitioner, and we plug him in at
Pecan.
Pecan.
And we've got room for all these people, I'm assuming.
Kind of. Room's getting, tight in some places. We moved, IT had to shuffle out into the hallway and shuffle some people around. We're opening up this area up here that used to be cardiopulmonary. Dr. Miller used to see patients up here. That is now gonna be wound care. Potentially maybe some of the specialties. If we add another doctor downstairs, we're gonna have to have a place for Dr. Hyder and Dr. Moore to see patients as well. So.
Do we own that little building across the street, pharmacy?
We are renting that building out right now. Dr. Gary is renting that and has a kind of a concierge practice, but she's also doing a lot of cosmetic or med spa type stuff, renting that. But she's renting 5 days a week right
But so we don't have room to put 2 people in there, rent
No.
half of it or anything like that?
now. We can find some additional room here and there. We've got a little bit of time, but it won't be long. We're gonna start running into some issues, but
Hence the long-term planning needs.
yeah.
Right.
Is there a dollar amount, a guesstimate you might put on the new MRI machine right now? Dollar amount you could bring in?
Not, I think we just, did you do
Yeah.
an increase on that slightly?
Yes. I've got it in my head, but I can tell you what it is.
Should be quite a bit more than what we had.
Yeah.
We need about 20% increase for that thing to break even. And I think Roger calculated that out back when we started this project, and it's like 12 more MRIs a month. And I think we can easily do that, so that's
Raymond
why we.
wants to work a lot.
I think
See this new toy I got.
this department manager was pushing.
She wants some free time. I can see the best around the corner.
I'm watching everybody else go on vacation.
Anything else on budget? And I guess the next question is would we like a budget only meeting or to dive in greater detail? And then there's the capital.
Last page is the capital request for next fiscal year.
Keyword is request.
Yeah.
I can tell you this next fiscal year is gonna be tough with the conversion and, because there is gonna be a period of time through the CPSI and Meditech conversion deficits. It'll catch up eventually. We're not losing money, but just the collection process will get slowed down, because of that. So, you know, we're gonna slow down on a lot of capital projects through that implementation process, mainly because everybody's gonna be plenty busy. But the big one on there, the number one, I would say, is the nurse call system upgrade. That's about $500,000, and if we have the money, that would probably, unless something breaks, that's probably gonna be number one, because right now we're having to scrap pieces from here, there, and other to make them keep it working, and that's a big safety concern, so.
We've got some lab equipment that's getting,
Yeah, I mean, our analyzer's 5 years old. You can run them from 5, our last one we kept to 9 years. So it's on there because it's hit the 5-year mark, but it's still working and functioning okay. You know, this is kind of like, say, a wish list. So I think it's one of those we'll address them as we, the radiology X-ray detector replacement, that might be pushed up fairly high if we break one right now. I don't think, the end of life is coming up on that, so we can't get it worked on or can't get anything done. So potentially be down.
How about the generator? How critical?
I mean, generator is if we are having a good year, that is a good project to look, because there is a potential instead of working with a company, I think we're looking more at potentially doing that project ourselves and being able to sell power back to the grid and make money to offset the cost of the generator project. So it could potentially, but you still gotta have that upfront $1 million in cash to start. So, we're gonna wait in a lot of cases and see how the implementation of Meditech goes, and we're gonna be paying for 2 systems for a good while in the middle of that while we're bringing up the new one and still have CPSI, we're still gonna have to be paying for two systems, so there's gonna be an added cost there. So,
Joe was talking about getting $1 million next month.
yeah.
$1 million here, we spend that in 11 days here. So our average spend rate, this is interesting, I thought, our average spend rate is $89,000 a day. And our average net income per day is $75,000 a day. And that's what gets you into the operating
I
loss.
did notice on the budget that we received in the email, I did notice there was no mention of grants. Do you, can you plan or budget for grants that you expect to receive, or how is that handled?
Yeah, I think we do have that budgeted in some of that, because we had a known grant with the IT.
Yeah. Some of those are kind of hard to budget because you just don't know what,
Yeah.
I mean, it's kind of, I would say icing on the cake, I guess, if you, I mean, if there's one we know about, yes, we're gonna budget for it, but, you know, maybe you'll keep out there looking for stuff and try to get as much as we can.
How much do you anticipate, will slow down on receiving? Specifically, if we got 87 days of cash, at the worst point in this, how many days are we gonna have? What's the cushion?
No, we're not talking, we're probably talking a week or two, probably.
Okay, so yeah, that's not a big risk.
Yeah, we're still gonna be bringing money in, but just maybe not at the rate that we.
So we're not gonna eat that up.
No, I think we're healthy from a cash flow. And between now and then, you gotta realize we're gonna get $1 million in September, and then we're gonna get about $4 million in tax money on top of that. So we're gonna add another $5 million to that between now and then. So we should be good from a cash standpoint, for that. You just wanna, in case something, you know, there's a hiccup, or you just wanna make sure you've got plenty of cash reserves available to do that.
That's important. Okay. I might ask, what's the trauma monitor for the ER?
It's one that they can keep the patient hooked up and go to radiology. So we have one that is a trauma, like it's a transport monitor, but the other one's, has to say, yeah, it's fixed. So it's to
stuck in
upgrade
the
it.
room, Right, so it can't go.
So right now, we only have one that we can transport. I mean, we can make it work, it's just, it'd be easier. It's a wish list. Sometimes we can just throw it on the bed and just make it work.
Thank you.
I guess the next question is, would y'all like another budget meeting to dive further into this?
Yeah.
Okay, we'll work on scheduling. Would you prefer day or evening?
Am I gonna be the only one there?
No, I guess the only person still working is the doc, so the rest of
I
us.
can be flexible, right?
On Thursdays.
I wonder if you guys pick.
Yeah.
Yeah,
You're the one
what's
there.
best for
We'll send
you?
you two options, one, and let y'all kind of, we'll narrow it down to two and send it and see who's available most, you know, and kind of have one more, because other than that, we're rolling right into the public hearing, so that way you're able to answer, and we can answer any questions in case we do have public showing up, but, you know, it's not long, we'll have public hearing on the budget and public hearing on the tax rate and be voting to approve those, so, I'll work with Joe and we'll send out a couple of days and we'll see which one works best for everybody and go from there. Anything else you have?
That's it.